Hi everyone, my name is Dr. John Podraza, and shooting a quick video today to talk to you about our upcoming ski spec next week. Just a little bit about me. I'm an active duty commander in the United States Navy and an intensive care physician currently stationed at Walter Reed National Military Medical Center. I have significant training and background in wilderness and mountain medicine. And so my involvement with ski spec every year is usually to work the medical tent and to help people that come to the event and unfortunately either get injured or suffer from altitude sickness. And I wanted to talk to you a little bit today about how ski spec is going to be a little bit different this year because of the COVID pandemic. So first and foremost, I want to say how excited I am. And I know everybody at Move United is super excited that we're actually going to be able to do an in-person event this year. And kudos to all of the people that have put in countless hours of work to pull off this event this year. And I know myself included, super disappointed last year that we weren't able to do it, but it was in the interest of everyone's safety. With that being said, we're going to have an in-person event this year, but we really want to make sure that we do as much as we possibly can to ensure the safety of all our participants, because we have people coming from all over the world, from different backgrounds, different states, countries, etc., and with potential exposure to different things. We want to make sure that we keep everybody healthy and everyone safe. In addition to that, and people with disabilities are at higher risk if they are able to unfortunately contract COVID, especially at altitude. And so that is what makes it even more important that we do a really good job protecting everyone and keeping everyone safe. So the very first thing that we decided to implement this year for attendance at ski spec is that everyone has to be vaccinated. Okay, so you need to show up with a photo ID and your COVID vaccination card. If you don't have the paper copy, we accept electronic copies of the card, or even just a picture of the card so that we can verify identity and verify last vaccination date to ensure that everyone is appropriately vaccinated. Appropriately vaccinated in this case means you have to have completed whatever series was recommended by the manufacturer of the shot that you got. So as an example, for me, I got the Pfizer vaccine. So it was a 2-shot course for me. And so I'm fully vaccinated. At this time, we're not requiring the booster dose for people to show up at the event, but by all means, if you want to get the booster before you come, certainly that would be encouraged, but it's not an absolute requirement. I want to also talk a little bit about some of the specific COVID-19 policies and protocols that we are going to have at the event. So first and foremost, anytime you're indoors, you must be wearing a mask, okay? That's not just a Move United and a ski spec policy, but actually the Beaver Run Resort is implementing that policy for the entire resort, which is important because in the state of Colorado right now, their vaccination rate, fully vaccinated, is somewhere between 60 and 70%. And as you know, the mountain's going to be open and people are going to be coming to the resort from all other areas, not participating in ski spec and potentially being exposed. So there's going to be some people out there that maybe not vaccinated. So really important that you wear your mask whenever you're indoors. Another really important thing that we want to emphasize is to socially distance as much as possible. Now, I know this is a social event and a lot of people come to this event every year and they're so excited to see their friends that they haven't seen in a year and maybe an old instructor that they used to work with and stuff like that. And as much as possible, socially distance. And what I mean by that is many of you come in groups, okay? So you're already exposed to the people that you have been in a group with. So then don't commingle groups. Try to stick with your group of people, because the more that there's commingling of groups, there's more chance that there's a potential exposure. And the last thing we want to do is ski spec become a super spreader event, which would be bad. The other thing I want to encourage everybody to do is pack hand sanitizer. Bring maybe a big bottle for your room, a smaller bottle like this that you can keep in your pocket all the time, and hand sanitize as much as possible. Hand washing also works great when you have access to those facilities, and do that as much as possible, and that will help reduce the chance of any spreading of COVID. Next, I want to talk just briefly about altitude sickness and COVID and how they differ. And first and foremost, I'd like to point you to a webinar I shot a couple years ago with Move United, specifically on acute mountain sickness. It's a, not trying to give myself my own plug, but I think it's a pretty good webinar. It's very educational and it'll give you a lot of background information. But basically, altitude sickness is typically seen when people travel to altitude from a lower elevation. Usually, a lot of us come from sea level, and you show up at altitude and immediately or within a short period of time after arrival, you have a headache. And then in addition to a headache, you get something else. You get nausea, vomiting, fatigue, lassitude, that type of stuff. And if that happens to you, by all means, come to the medical attendant right away and let us know, because if we start treatment right away, we can turn that around really quickly and ensure that you have a better event. If you wait and it sets in and it gets bad, it's harder to treat and it's more likely to ruin your whole trip. Now, altitude sickness does not cause fever, okay? It also does not initially cause cough or runny nose or sore throat. So if you have fever, cough, runny nose, sore throat, especially before the event starts, do not come to the event. That means you have some type of infection. Now, it may not be COVID, it could be the common cold or it could be the flu, but the last thing you want to do is come to the event knowing that you were feeling unwell and then potentially exposing a bunch of other people. And we'd really like to avoid that. Every year, prior to the COVID pandemic, we have people that show up and they come to the medical attendant feeling lousy and they don't have altitude sickness, and we end up diagnosing them with the flu or a common cold or something, and they potentially get other people sick. And it's one thing to get an illness at sea level and feel lousy. That feeling is multitude tenfold or more when you have it at altitude. So we really want to avoid that. So again, watch the webinar on altitude sickness. Don't come to the event if you're feeling sick beforehand. And if you do get sick, by all means, please immediately reach out to the staff, okay? So the best contact for that is going to be James Arnold, okay? His phone number is 240-268-5372. All right, I just want to wrap up by saying once again how excited I am and all the staff at Move United are to have to host everyone this year at Ski Spec in person. We're looking forward to a phenomenal event. We can't wait to see everyone there. We want everyone to have an awesome trip, but most importantly, we want it to be safe. We want it to be successful, and we don't want anyone to get sick, okay? If you do have any questions, again, please contact James Arnold, 240-268-5372. Podraza, out.